Cardiography, or it is also called as electrocardiogram. The electrocardiogram is the representation of the electrical events of the cardiac cycle. Each event has a distinctive waveform. The study of waveform can lead to greater insight into a patient's cardiac pathophysiology. ECG can identify arrhythmias, myocardial ischemia and infarction, pericarditis, chamber hypertrophy, electrolyte disturbances, and drug toxicity, that is digoxin and drugs which prolong the QT interval. Depolarization. Now, what is depolarization? Contraction of any muscle is associated with electrical changes called depolarization. These changes can be detected by electrodes attached to the surface of the body. Repolarization. Repolarization is the phase of recovery or relaxation. The dipole moment at any one instant during recovery is less than activation. Recovery is a slow process, lasts 100 microseconds or longer, and occurs simultaneously over extensive portion of the fiber. Pacemakers of the heart. SA node, it is a dominant pacemaker with an intrinsic rate of 60 to 100 beats per minute. AV node, that is atrioventricular node, backup pacemaker with an intrinsic rate of 40 to 60 beats per minute. And ventricular cells, backup pacemaker with an intrinsic rate of 20 to 45 beats per minute. The normal conduction system. The electrical impulses starts at the SA node and it transmits to the AV node through intercostal tracts. From there to bundle of His, then right and left bundle branches, and finally to the Purkinje fibers. So first is atrial depolarization. P wave represents atrial depolarization, that is atrial contraction. Second is ventricular depolarization. QRS complex represent ventricular depolarization, that means ventricular contraction. Third one is ventricular repolarization. T wave represents ventricular repolarization, means ventricular relaxation. Now the question will be, where is atrial repolarization or atrial relaxation? So when there is QRS complex which represent ventricular depolarization, at the same time there is atrial repolarization or atrial relaxation. So P wave indicates atrial contraction, QRS complex indicates ventricular contraction, and at the same time there is atrial relaxation, and T wave represents ventricular relaxation. These are segments and intervals of Ecg strip. There is PR interval, PR segment, QRS complex, QT interval, and ST segment. And we have got PQRST waves. This is the modern ECG instrument which is used in the hospital. The Ecg leads have 12 leads. There are 3 standard limb leads, 3 augmented limb leads, and 6 precordial limb leads. Recording of the ECG. Limb leads are 1, 2 and 3. Each of the leads are bipolar, that is, it requires two sensors on the skin to make a lead. If one connects a line between two sensors, one has a vector. There will be a positive end at one electrode and negative at the other. The positioning for lead 1, 2 and 3 were first given by Enthoven. So it is called Enthoven's triangle. So these are standard limb leads. That is, one is on the right arm, second is on the left arm, and third is on the left leg. Then there is augmented limb leads. That is AVR, augmented vector right, AVL, augmented vector left, and AVF, augmented vector foot. Then there are precordial leads, that is V1 to V6. So this picture shows the positioning of the precordial leads. That is V1, the lead has to be placed fourth intercostal space to the right of the sternum. V2, fourth intercostal space to the left of the sternum. V3, directly between V2 and V4. V4, fifth intercostal space at left mid-clavicular line. V5, level with V4 at the left anterior axillary line. And V6, level with V5 at left mid-axillary line. Clinical interpretation of ECG. Accurate analysis of ECGs requires thoroughness and care. The patient's age, gender, and clinical status should always be taken into account. Many mistakes in ECG interpretation are errors of omission. Therefore, a systematic approach is essential. This is the standard Ecg strip where there are small squares and big squares can be seen. So in the ECG paper, if we take one big square, horizontally, one small box is equal to 0.04 second and one big box is 0.20 second. Vertically, one small box is 0.1 millivolt. So one big box is 0.5 millivolt, that is half millivolt. So two big boxes is equal to 1 millivolt. So these numbers are very important to identify normal and abnormal ECG. This is the normal ECG. So in this you can see all 12 leads, that is standard limb leads 1, 2 and 3, augmented limb leads AVR, AVL and AVF, and 6 precordial leads, that is V1, V2, V3, V4, V5 and V6. So how to interpret the ECG? There are 6 steps to interpret ECG. That is, first one, identify and examine the P wave. Second, measure the PR interval. Third, measure the QRS complex. Fourth, identify the rhythm. Fifth, determine the heart rate. Sixth, interpret the strip. Step 1, identify and examine P wave. P wave should be present and upright. Step 2. Measure the PR interval. PR interval should be 0.12 second to 0.20 second. That means our one small box is 0.04 second. So 0.12 second is 3 small boxes. So it is 3 to 5 small boxes. Within that, if PR interval is coming, that means it is normal. Step 3. Measure QRS complex. QRS complex should be between 0.06 to 0.12 seconds. That is 1.5 to 3 small boxes. It should be within 1.5 to 3 small boxes, which represent normal QRS complex. Step 4. Identify the rhythm. So identify the rhythm is regular or irregular. For that, you have to see the distance between RR interval. You can take a scale and see the distance between the RR interval. If the distance between the RR interval of entire Ecg strip is same, then the Ecg rhythm is regular. If it is not same, then it is irregular. Step 5. Determine the heart rate. So there are two methods to determine the heart rate. So in the first method, we can use this for irregular rhythm. This is only possible for 6-second Ecg strip. So in 6-second method, you can identify in 6-second method, you can see on the top there are 3 small black lines. So if these 3 small black lines are present, then it indicates it is 6-second method. So what you are supposed to do, in between these 3 small black line, count the number of R's, R wave. So how many number of R waves? Multiply by 10. So in this strip you can see there are 6 R waves are present. So 6 into 10, 60 is the number. So this Ecg strip represent the heartbeat of a patient is 60 beats per minute. So this is the first method. So there is one more second method. This works only for the regular rhythm to determine the heart rate. Here you have to see in between any 2 RR waves how many big boxes are present. So you can see there are 5 big boxes are present. So you have to take a standard number is 300. 300 divided by number of big boxes in between 2 RR waves. So that is 5. So 300 divided by 5, it is 60. So it is 60 beats per minute Ecg strip. This works for regular rhythm. Step 6. Interpret the strip. Again, overall, you all can go through the strip. Thank you. Like, share and subscribe.